The PORTICO-I study is examine the real-world performance of the Portico valve. Portico valve is from Abbott. It's a self-expanding technology with an inter-annular position of the leaflets. It's a recapturable system. It's a very flexible system. And it's been CE-marked, and the IDE trial in the US is done, and Abbott expect to have approval in the US within 2019. So the PORTICO-I study is a real-world study, as I said before, examined 941 patients. It's actually moderate to high-risk patient, mean STS score is 5.8%, quite old patient, 82 years of age, more female than male, to see how the PORTICO-I is performing. The primary endpoint in PORTICO-I is all-cause mortality at 12 months. And it's actually 12.1% with a cardiac mortality of 6.6%. So this is really good outcome in patients who are that old and with that high risk score. But there's a lot of other interesting features as well, how the valve is actually performing. And we can see that the mean gradient is very low, it's only 8 millimeter mercury, and the opening area is quite high, 1.8 square centimeter, despite most of the patient is actually female in the study. We also very importantly look at the rate of more than mild paravalvular leak, and it's as low as 2.6% at 12 months. So it's really among the top of the class within TAVI procedures. The pacemaker rate at 12 months is 18%, so it's very similar to other self-expanding technology. Yeah, this is a next generation device. The Portico valve is resheathable, so you can have a better position. So I think the results are very, very similar to what you see with the other valves on the market, with the Evolut Pro and the Sapien 3 valve. The Portico valve is in many institutions the working horse. So you can use it in all kinds of patients with borderline access, with very tortuous anatomy, horizontal aorta, calcified aortic valves. So I think it'll suit most patients. The only limitation for the time being is largest size is up to 20 millimeter annulus size. So for the really large anatomy, you cannot use Portico for the time being.